Well, welcome back to the interactive segment, and I'm ready. You must be ready too with your phones and your tablets, and send that tweet or Facebook comments. Maranturi.
Hello.
They should send tweet and Facebook comments. I was right?
Yes. They should tweet.
They should tweet
and send their Facebook comments.
Send Facebook comments.
Yes.
Okay. So what is it about?
Today is about part 2 of the cholera. We did cholera yesterday.
And you were laughing at me when I said the cholera will escalate to Ebola. Now laugh again.
Steve, but you see, when we go, how can cholera escalate to Ebola?
I'm just letting you know that these are two serious issues. Do you know what I mean?
Yes, sir. Oh, correct, sir.
Oh, correct.
Yes.
So what's up?
But today, apparently, you know, it's become so widespread that it's put a lot of strain on our health services, and so we are talking about it, and also perhaps advising ourselves, because the idea would have been that by now we would have a lot of knowledge about cholera, how to prevent it. It's an epidemic. It's perennial almost. That every year we have a problem. So why aren't we tackling it? Is it like once the rainy season is over, then we go and forget about it? When it comes back, then we start, or we need a total mental overhaul. And it's happening in areas that are seen as very poor neighborhoods. You won't find, excuse me to say, the Labonis and the East Legons telling you that. Exactly. But you're getting it in pockets of areas where sanitation is actually a big problem. So we're talking about
it. So let's hear what people have.
Thank you. Wherever you are, this is JN Interactive. My name is Barima Osei. Welcome to your show. So you can join the conversation on all our online platforms. You will find us facebook.com/joinnews-on-TV. Like our page first. Put that, then I will stand here and amplify your voice and share all you're sharing with the rest of the world. We're on Twitter. We tweet at Join News on TV at JN Interactive GH, and my personal Twitter handle is at MN Toure. 3 of these handles are ready to retweet your thoughts and share what you're sharing with the rest of the world. You can send us your email, joinnewsim@multitvworld.com. Our WhatsApp number remains 0540109009. And JN Interactive, as always, is where tech meets news to set the agenda. So JN Interactive discussed the cholera epidemic, which forced the La General Hospital to convert its outpatient department into a cholera unit as high numbers of cases of the illness overwhelmed the hospital. We did that yesterday. We also reported that at least 5 people had so far died from the disease at the hospital alone in 1 week. Today, however, the outbreak has brought pressure on infrastructure at several hospitals and clinics in parts of the capital, and health officials at the Mamobi Polyclinic have indicated that the increasing number of cholera cases referred from other hospitals to their facility was alarming. 58 cholera cases have been recorded, with 1 death so far at the clinic, and the story is actually trending online. So let's do this together and go through it. And this is actually on myjoyonline.com. You find the story there, and the headline actually says cholera. Let me mirror it so we can see it together. Spate of cholera epidemic puts pressure on hospital facilities. That is what the story is actually saying here. And you know, most of the facilities apparently that Joy News visited you know, today revealed that there were inadequate facilities at the hospital, especially beds to house ailing patients. And the Accra Metropolitan Assembly reports said you know, had dispatched vans to affected areas in an attempt to intensify public awareness. And the areas, according to Samson Boating, who is the AMA Public Health Director, that at Adona, they have sent one there, Agbobloshi and Sahara and all other cholera flash points, and 15 cholera patients were reported dead out of over 870 cases in the Greater Accra region alone since this year. Between June and July, the Greater Accra region has recorded a total of 878 cholera cases, with the Accra metropolitan area alone recording 604 of these cases and 8 deaths. And that is very, very, very alarming indeed. And so we have a resource person on the line that I want us to speak to. He is in the person of Dr. Bedu Sarkodie.
Hello.
Hello, good evening, Doc.
Good evening.
Welcome to JN Interactive. How are you doing?
Thanks very much. And how are you doing too?
I am fabulous, Grace. First of all, I'd like to ask whether the reports we are receiving are actually true, that the cholera epidemic has actually put a strain on health facilities.
Yes, indeed. We've had confirmed cholera outbreak in Greater Accra region, specifically Accra Metropolis, and 3 other districts within the region. The cases upset, the number of cases that are coming in at the point in time gets in excess than the cholera beds that we have. So through that we have an outbreak in hand, and then the cases that we are having at times get in excess of the facilities that we have, stretching beyond our resource with regards to the space we manage the cases, and then also the facilities available. But then the infusions, the logistics, and those things that we need to we use to manage the cases, we have enough. But at times we are challenged by space.
By space. Okay, then that actually then goes to say that we need more hospitals, right?
More hospitals, and the situation like this, it's appropriate to put up temporary structures, which we quickly would are taking steps to where the cases go often. We have to get cholera treatment center, which is just a knock down prefab facility, the platform, so that we manage those cases at those centers.
Right. If
temporary structure, it doesn't have to be the walls, the block or brick walls. Then we can use temporary structures. That's what we did in 2010, in 2011, when we had this at the Rich Hospital OPD in Badaka. We had a cholera treatment center, which is a temporary structure where the cases are managed. And because when the outbreak is over, then it becomes somehow redundant. If it is a permanent structure, then that will redesignate it, decontaminate and disinfect the area, and redesignate it for something else. But it's a temporary structure. We can remove the place, remove it, and then do something else at the place.
But speaking of structures, if you get the structures temporary, as be it that you're asking for, would you have enough staff to work in these structures?
Outbreak, when it happens, we can designate other staff from some areas to support. This is if we are having cases in excess of what we expect. So it doesn't happen often, but when it happens, we may have to re-strategize so that if you are challenged by staff, then we can redeploy staff from other areas to go in and support.
Right.
So that is what that will be our strategy with regards to staffing. So that will solve the problem with it.
Okay. Doc, when you were speaking before, you said that this had happened before, and the emphasis now is on the fact that cholera has now become something perennial, like flooding in this country, if we can call it that. What is your outfit doing to actually help the people who come there to say that, look, this has become, or is there any research that you're conducting, let's say with government, to say this is what happens every single year? How can we stop this from happening every single year, that it doesn't stretch our resources as well?
Right, thanks very much. You see, cholera is a disease. So when you are talking about it, everybody looks at health. But then the determinants and what leads to cholera and its outbreak stretches beyond health. We're talking about environmental sanitation, personal hygiene, people adhering to sanitation issues. If these things are not addressed, and we see raw fecal matter being discharged into the ocean, and that people defecate anywhere, and that food material items, vegetables sold in the market, and we don't take this and address them, then it's a problem. You need safe water to make sure that people have easy access to potable, safe water. This is not the health sector to provide it. What you can do is advocacy. So all others should do their part. Water and sanitation, Food and Drug Authority, the local government has the environmental staff, and they have to all do their part of it so that the environmental sanitation will improve, the food handling will improve, the water, safe water access would be improved. And the biggest risk that we had recently was the flooding that we had here in Accra.
Yes.
When it floods and the refuse are heaped, the refuse dumps are heaped, and then the gutters are choked, all these areas get flooded and contaminate the water bodies and water sources. So people using this then stand at a big risk of getting cholera. This, you need to address it as a country. You should see it as a social emergency and not that something that health alone should address it. So all of us that you have to do, you have to take in this. Media have a big stake. You need to let people know about how others get cholera and how do you prevent it. So the education part of it, not that now you're having cases that you wish to highlight it. Before the rain starts, what do we do to let people conscientize the community to know that we have to, as a part of social responsibility, let people know what to do to prevent cholera. All others, individuals have our stakes, group of people have our stakes, as a national leadership have our stakes. And as much as possible, if everybody does what is expected, we can prevent and protect against cholera.
So then we need a multi-pronged approach to stopping this.
Approach. And indeed, there's the National Technical Coordinating Committee consisting of the health, security, NADMO. But if it goes beyond what you are doing, it becomes a disaster.
Right.
And at that time, Interior, NADMO, they take over. Let's hope it doesn't go that far. If you are talking about access, water access, so at that meeting, all the leadership of these agencies whose activity impacts on health have to be present, and you shouldn't just leave it to the health sector alone to handle. Let's see it as social developmental issue, national issue, where multiple sectors are involved and agencies are involved, and what is expected of each of these agencies and development partners to make sure that things that need to be done to prevent cholera will be adequately done so that we don't have recurrence of this event or situation year in, year out. Anytime there is flooding, I start to panic because there is the likelihood that this thing will happen. That is a situation that we face in the country.
Okay. Dr. Abedu Sarkodie, thank you so much for helping us today on JN Interactive.
Thank you very much.
You're welcome. And we've been out there to talk to you as well about what is happening. And we've been asking you so many questions. But in our first video blog, we wanted to ask your feelings. What do you make of this sorry state of affairs, if I can call it that? Let's take our first video blog. Don't go away.
Cholera is an outbreak disease. It comes impromptu. So if you make provision for such,
cholera of late is becoming like an epidemic in Ghana, and I can't really get it. The people in Ghana now are not sticking to what they were doing before. You know, we used to have adverts that people wash your hands before you eat, do this and that before you eat, do this after toilets, do this after whatever. But now you fail to see them on TV. It's because they believe that we have already educated ourselves very much, but it's still a problem, and they have to get it sorted. Now hospitals, far back as 2008, we're not having so many cases, but today they are getting full with cases of cholera. It's not like it's a big problem that we can't solve, but we can't really solve it. It's just we have to put more time and then put more efforts, more resources. We have to allocate more resources into those things so that we can take them away once and for all. Now they are even talking about stuff like Ebola viruses and stuff. If we can't cater for common cholera, bacterial disease, how are we going to cater for viruses? So we just have to make sure we do the right thing at the right time.
We should try as much as possible to dispose waste wisely, because it's the filthiness of the environment that causes the outbreak of cholera. So for me, I think if waste management is handled properly, all these things can be capped.
More hospitals should be built by the government to create more space for patients who have been infected by cholera.
When we talk of cholera, you see hygienic, right? But many of the Ghanaians don't have the time to wash their hands, to take more tablet. Yeah. Even I could see Ghanaians when they are about to eat, right? They don't even usually wash their hand with the soap, right? They do wash their hand with the raw water, but it is wrong. They have to wash their hand with the soap, right? And after that, after eating, they have to wash it with the soap. So that is the contamination. And some of the people too, they take their food and the gutter and these things. Yeah. So we have to eat the clean food. Even the water we drink is a problem.
Yeah, that's what the gentleman is saying there. Well, some comments have dropped in. Let's take some of them before we go and take our next video blocks. A precursor, as always, it's already been said. We're asking what pragmatic measures you are putting in place to avoid contracting cholera. How can the citizens help end this perennial menace? And also, we are comparing Ebola and cholera, which scares you the most. Ooh, they're all diseases, huh? They're all scary, scary, scary. Jeffrey Jefferson Queno begins with us, and he says, inadequate hospital beds and infrastructure. Sometimes when I hear some of these things, then I begin to ponder the kind of leaders we have in Ghana. Basic necessity to wahala. My 5-year-old daughter told me yesterday that she will build a hospital for me. I don't want to believe that my 5-year-old has a vision than those in the helm of affairs. I'm therefore calling Mr. President to make my daughter Minister of Health. Even cholera we cannot handle. How much more champion, no cure, Ebola. God must come to our rescue concerning Ebola, because Ghana as a nation can't stop the spread. If the spread finds its way here, I'm sure that's what you're trying to say. Marion, I welcome your Black Wednesday because people are indeed dying of cholera. Okay, Mensa John says, "Hi, Ebola." Paul just says, "Let us all try to keep our environment clean and safe in order to prevent this cholera. And as for this Ebola, God save us." Christian Salvo, good evening. Marion, well, all Ghanaians must be very cautious about this Ebola and cholera disease, which is very dangerous as far as our health issues are concerned. We must remember that prevention is better than cure. Therefore, we must keep our surroundings clean so that we will stay off this disease. But Marian, although I'm safe, I am very scared of Ebola more than cholera, because Ebola is more dangerous than cholera. So let all of us pray and stay safe, as well as in the difficult moments. Oh, may the Almighty God help and protect us. Okay. Orlando says this government is boring. The government is not like a literature or mathematics class. You call him boring. I mean, hello. Or like a music track that you say, oh, this music is boring. Or food, and food is boring. Really? Okay. I see. One more comment and then we'll take our video blog. Kennedy Asare Queen says, I'm making sure that my environment is clean always. Check the foods I buy from outside. Stop greeting people. And also, the people should learn about cholera so that we will all be well. Okay, that's what you're saying. In the next video blog, we are asking, what pragmatic measures are you putting in place to actually avoid contracting the disease? I want to know pragmatic, okay, to say this is what I'm doing, this is what I'm doing, because we all have to help each other. After all, let's take our next video blog.
Myself and my family, if we are about to eat or something, or my friends, I always make sure I tell them, Masa, me also po we say pigeon boys, me also po monjina mo fa homonsa. No lie, you know be why who here say be dey, because we grow. You understand? We grow, we no go fit do that thing. So it's just something that people should learn. when you go to the public toilets or whatever, the urinals, everything, just wash your hand. When you are buying, to make sure you buy from a correct place, not some place that you yourself know that it's not good, but because you like the taste of the food, you know, you have to go for quality. If the thing is good and the place is not, the surroundings are not clean, then I mean, you have to get out of there because you are giving yourself a big problem.
I'm very careful with what I eat from outside because when you come for work, you can't really prepare food at work. So you definitely buy from outside. But then I really mind what I buy. I make sure the surroundings are clean and all that before I buy what I buy.
Before I take anything, I make sure I wash my hands. I eat hot meal, and then I'm looking at my surroundings. I make the place clean, you know, rubbish. I make sure I cover them, prevent flies and stuff. So that's the other thing I can say.
Myself, I wouldn't buy food from outside like anyhow. Sometimes you go, the food is not covered near the gutter, smelling place and other things. I wouldn't like to go closer to that place and then buy food from that side. And I'll make sure I wash my hands anytime I visit the privates and then touch anything with soap.
The general public is being educated on abolishing eating from outside. So me personally, for now, I will not be eating food from outside, and I will be careful on the things I take in, as in the food I eat.
So you have to take a good food, right? And you have to take a good, you know, food. That's better.
So as we are crying about cholera, we are also crying about Ebola because the neighboring African countries, some of them have reported cases of Ebola, Liberia, Sierra Leone, even Nigeria now. So we are asking you, whilst we are fighting cholera or trying to prevent it, between the two, which one actually scares you the most? And I'm sure I know what your answers will be, but let's take our video blog.
I think Ebola is more serious than cholera.
Ebola really scares me. You know, since I heard about Ebola coming to Ghana, and it's not even here, but people are just sending me messages on WhatsApp and then all those other social, you understand, that about the Ebola virus, some pictures about their symptoms, people having them. I mean, I was scared. I'm really scared.
I'm scared of the two. I don't know. I'm very scared about the two.
But then I know it's not coming to Ghana. God is in control.
For now, it's Ebola, so I think Ebola is very serious. So I'm trying to run away from it. Yeah.
Yeah, you know, the Ebola is a new disease we have heard of. It's a new disease, and cholera is in the system already, we know. But the cholera and the Ebola, you know, dangerous, and you know, the Ebola too is something determination that the what do we call it, the contagious in it. It's a very serious contamination. That's contagious because of the bacteria.
Yeah, so I'm sure you know it already, so let's try as much as possible to keep our surroundings clean so that we don't catch either Ebola or cholera. Final comments before Steve joins me and then we can wrap up the show together. Benjamin Agri says, Ebola, because it scares me, it has no cure. Let me see, let's refresh this and then but for cholera, I think it's better. Lack of attitudinal change towards sanitation. We must change now. God save Ghana. And this one is coming from, your nickname is Ogana from Sunyaini. And Nelson says, I think Ebola is much more scary because there is no treatment for it. But that doesn't mean that cholera is not scary. Dawood Al-Hassan, there should be a public education on personal hygiene in order to prevent future occurrences. And that is where we drop the curtains on the comments and the entire show for today. Steve is back. We can wrap up the show together.
Did you mean Ebola? I'm sorry.
I don't remember.
A photograph of an Ebola victim.
No,
That's
I don't want to
crazy.
see it.
Everybody is very worried about Ebola. I am too. We all have to take precaution and pray that our governments and health authorities are able to be proactive to save our lives.
Our lives from
My name is Stephen Enti. And on the sad note, bowing out with sadness and Ebola.
My name is Marian Toure. Enjoy the rest of our program. See you same time tomorrow.
Thanks for hanging out with us.
Okay. Bye-bye.
Good evening.